Good morning. I'm with Iskra Potgieter from University of Nottingham. She's doing her PhD on the topic of hyperacusis, specifically in children, and she will be presenting some of her results of her studies in the sixth international conference on hyperacusis and misophonia, which is planned for 1st and 2nd of July at Birkbeck College, University of London. So Iskra, tell us a little bit about your project.
Good morning, Hashir. So my study will be, it's basically a qualitative analysis that is exploring the way that hyperacusis presents in children and how it impacts on their lives. And I will be using the data that is available on in online discussion forums for that. So that is really the topic of it. Do you want me to go a bit more?
So it's so you basically looked at the forums that parents of children who are sensitive to sound, and they basically post questions and share their experiences and wants to get advice from one another. Is that right?
Yes. So we used conversation threads, which is it involved an initial message posted by a parent or carer of a child with hyperacusis, and it was followed by responses by other users, usually giving comfort or explanation as to what the symptoms meant. It was usually children of 3 to 4 years of age, so toddler to preschool age, and the sound sensitivity was not diagnosed by a professional yet. So parents used the online forums as a first point of contact for support and explanation before they went on to seek further diagnosis.
And then when you were looking at these, were there any way that you could identify if these children had other problems like autistic spectrum disorder or learning difficulties as well, or it was hard to establish that?
Because the children were quite young in the sample, many did not have any other diagnosis. But a lot of the users who responded to those initial messages did suggest autism or ADHD as potential causes of the sound sensitivity.
That's very interesting. And I guess that you will be presenting on what are the main complaints of these parents and their experiences in a form of, because it's a qualitative study, isn't it?
Yes, so we aim to answer the two questions, which was how did hyperacusis present in children and how did it impact their lives? But we were not restricted to these questions. We also included any other relevant considerations that people may be interested in when it came to hyperacusis in children. So things like prognosis, onset, parental concerns, and the impact of the condition on their lives as well. Teacher awareness, and of course the impact on the children's lives was quite extensive. We generated quite a few categories within the impact theme itself, going into the children's experiences at home, at school and nursery, their ability to just basically go outside, go on holidays, social activities, extracurriculum classes, and so on. So we'll go into that in more detail in my presentation.
Fantastic. Yes, I love to learn from you and the result of your study, because it's such an important issue, and I think it will be very beneficial to researchers who will be in the conference to consider these factors if they are developing questionnaires or interventions. Also for clinicians, to when they see children with hyperacusis, then your study can help them to give them some clues, if you like, what to look for in terms of assessing the impact of hyperacusis on the child's and their family life, and how to basically fine-tune their interventions to minimize that kind of impact. Fantastic. So I look forward to your presentation. I think yours is planned for 2nd of July, Saturday.
Okay, that's great. Thank you.
Fantastic. Thank you very much.
Thank you, Hashir.